So the pharmaceutical drug industry executives are thinking, yet another set of conditions where people choose cannabis over our drugs. Or is this the force of another industry? New research on the use of medical cannabis among people with rheumatoid arthritis and related conditions finds that more than 6 out of 10 patients who use cannabis reported substituting it for other medications like NSAIDs, Advil or Aleve, opioids, sleep aids, and muscle relaxants. Most patients further said that the use of cannabis allowed them to reduce or stop their medications entirely. The study was funded by grants from the National Institute on Drug Abuse and the National Institute of Arthritis. The results were recently published in a journal by the American College of Rheumatology. The primary reasons for substitution of prescription drugs for medical cannabis were fewer adverse effects, better symptom management, and concerns about withdrawal, wrote the authors. Substitution was associated with significantly higher symptoms, including pain, sleep, anxiety, and joint symptoms, improvement of those symptoms. So data from the study came from an online anonymous survey of adults from the US and Canada, solicited by the Arthritis Foundation. 1,727 people completed the survey. 763 of the respondents, that's 63%, said that they currently use cannabis. 655 said they never used cannabis, and 268 said they had used but had since discontinued. Of those who had used cannabis, about 2/3 reported a diagnosis of inflammatory rheumatic disease, and a similar number reported concomitant conditions such as fibromyalgia, osteoarthritis, and mechanical spine pain. 44% of the respondents used CBD, 27% used THC, and 20% used a balance of THC and CBD products, type 2. About the same number of respondents inhaled as used edibles. The authors noted that inhalation was a common method of administration with all the attendant risks of respiratory disease and aggravation of an inflammatory condition. They may not realize that many people who inhale cannabis don't complain or have signs of respiratory disease. However, they concluded, given the immediate pharmacokinetic effect of inhaled cannabis, this method of administration may be most satisfactory for people seeking rapid symptom relief and especially for pain. Another finding was that more than half of the participants used cannabis at least once per day. More and more research studies suggest that patients with a variety of conditions use cannabis as a substitute for other medications. For example, a study published in the Journal of Nurse Practitioners reported that prescription drug use decreased significantly after medical cannabis use, and health characteristics and symptom intensity improved significantly. A study of over 500 veterans noted improved quality of life and reduced over-the-counter and prescription use. The same was found in another study of elderly experiencing considerable improvement in health and well-being and moderately reduced opioids. So what happens when the pharmaceutical industry loses revenue to cannabis sales? It's well known that Big Pharma influences government-controlled substances and rescheduling. They hire ex-officials from the DEA. Just last year, the DEA's second in command had to resign because he consulted with a pharmaceutical company sanctioned for suspicious painkiller shipments. During the opioid crisis, Big Pharma devised tactics to push back against the Drug Enforcement Agency and blame the federal government for not doing enough to stop the epidemic. Some say that this news upsets alcohol and tobacco industry, who desperately want to make cannabis a vice rather than a wellness product. Meanwhile, people are choosing cannabis over pharmaceutical industry pills. This is Dr. Jean Talleyrand with High at 9 News.
Man, this is great news, Dr. T. I mean, this is just proving what we have believed for a long time. based off of just anecdotal evidence. And now we got some studies to back up our hypothesis from all of this that we've been doing over the years.
Yeah, a lot of people are choosing cannabis as a wellness product rather than a vice. Will this, with the powers that be, does this make a big shift in how they behave around cannabis? Is this not good for them because they want it to be a vice and alcohol and tobacco want to take over cannabis? Or is this not good for pharma, or is this good for pharma? Those are my questions for, the big players who are moving us around like pawns.
Very, very.
Well, I think this is why we're seeing a big shift in people who are using cannabis, especially as they get older in age, right? So we see people who are baby boomer age who've been told, like, this is bad, this is a drug, just say no. And now as they're reaching these stages of life where they're dealing with all these health issues and they're have nowhere else to turn. They're not finding relief in pharmaceuticals. They're finding relief, but the cure is worse than disease in a lot of senses. So I think that's a big reason for that trend. And I don't know how much time you guys have spent in the state of Florida, but Florida is very known for its opioid epidemic. And if you notice, those billboards that are for pill mills have turned into the doctors didn't give the pill mill boards up. They just changed them to, they will now write your cannabis recommendation, which I also have an issue with. I think you could go to guys like Dr. T who actually understand and believe in the medicine, because there is a requirement that your doctor actually treats you like a doctor and actually kind of follows up with you and is able to give you kind of care suggestions and treat you in a way that you should be treated at any other physician. And unless you have that cannabis-based education, you're not able to do that. So I think we're obviously scaring pharma, and we're scaring those pill mill doctors because they're realizing they're writing less oxy prescriptions and a lot more 12 plant counts. So I love to see it.
A lot of them also have moved into ketamine clinics.
Yep.
Yeah,
that also.
That part.
Glad you're here for that one, Matthew.
Yep.
Got your back.
Any thoughts on this, Dr. Mark?
Yeah, they just, if they end prohibition and this is treated like an agricultural commodity, the market will sort of work out itself. I don't think, again, the FDA has a proper way to sort of regulate it. They shut it down. The idea of it being a dietary supplement. So, okay, if it's not a dietary supplement, it's certainly not a drug, right? It's not an active ingredient that's packed into some pill that's then been shown in clinical trials to do such and such. Although, with the fact that there are FDA-approved drugs like Epidiolex and like Marinol and such, but the plant from which it's derived is still Schedule 1, which by definition means no medical use whatsoever. I mean, the whole thing is just a hypocrisy.
Absolutely.
And we got to just keep reminding everybody the scheduling system was invented by Richard Nixon to go after the civil rights movement, the anti-war movement, free speech movement, Black Panthers, the Weather Underground, the SDS. It's
look at that. Even more.
There's no actual medical purpose for the scheduling system.
Even more the reason no one should be supporting Schedule 3 then, Matthew, just based off of that.
One should support any scheduling system, nor the Republican fascists that initiated it.
Whoa.
I love you.
Whoa. I mean, I think the scheduling system is a tool used by the pharmaceutical industry to control what doesn't enter. So they're definitely interested in controlling it. The question is, do they care? Do they see cannabis as their own? Or is it really alcohol and tobacco? Who cares?
And
I think they all care. I think anybody who seeks to monetize it cares, right? That's why we see Philip Morris having cultivations up in Humboldt. That's why we see GW Pharmaceuticals, the former GW Pharmaceuticals, doing things like Epidiolex and trying to patent and control the aqueous suspension of cannabinoids, which they fucked up on because they didn't understand the plant. So, I mean, I think that they all have a stake in, and it's racing to see who can monetize it first.
Fair enough. And I do want to introduce to everybody Josh Swider, who is the CEO of Infinite Chemical Analysis Labs. And welcome, Josh, coming on today. Thank you so much. Do you have any thoughts on this?
Yeah. I mean, it's always an interesting thing when you talk about Schedule 1 narcotic and then we're scheduling a plant with multiple compounds. It doesn't make sense. So I think going back to it, it's how does Marinol get on it? I 100% agree. Marinol normally isn't grown, though. It's not extracted. It's made in the lab, too.
Yeah, it's a synthetic.
It's negative trans delta 9. Exactly. Nothing else.
Negative trans delta 9.
Oh, don't tell Trump and the Republicans that it's got trans in it, dude.
Oh boy.
Oh man.
Oh man. You know what? On that, we're gonna go to a commercial. We are gonna be right back.